All right, welcome everyone to our Boost monthly webinar with Dr. Allison Mulcahy, who's a board certified doctor of emergency medicine and integrative medicine. And then myself, Jen Gibbons, a holistic practitioner who integrates Chinese medicine with functional medicine and health coaching. So today we're going to discuss an integrative approach to pain and injury. So of course, we look forward to hearing your questions, so you can submit them into the Q&A box. You can also share your thoughts in the chat box. And just to get the conversation going, I would love for you to write in the chat box now something you can do to reduce pain. So let's get started, and welcome Dr. Mulcahy, and thanks for sharing your time and your expertise with us.
Awesome. Thanks so much, Jen, and thanks everyone for being here today. I'm going to share my screen here. See that okay? Perfect. Okay. So today we're going to talk about an integrative approach to pain and injuries. And as Jen just mentioned, I'd love everyone to just put in the chat box one thing that you can do to decrease your chronic pain. Just put in the chat box, and Jen will let us know some things that are coming in.
Yeah, we've got a bunch already. And Kim's starting us off right out the gate with ultimate repair, which is sleep. And Owen's getting physical with some stretching. And we have Chelsea that's recommending curcumin, which we know is a great anti-inflammatory and in a lot of pain supplements. She also remarked about other anti-inflammatories and great tools like magnesium, which is wonderful at relaxing muscle tension. It's actually something I take 400 milligrams before I know it. I'm going to go and beat myself up, like as it is today, shoveling snow, because we've got a nice weather storm coming in through in PA. Kelsey wrote, just avoid eating inflammatory foods. So going to a preventative angle. And Garrett's talking about a great routine for stretching every day. So being consistent with your stretching. And Kelsey also remarked about cupping, self-myofascial release. And cupping's fun. It's just, my 11-year-old son loves cupping. It's like one of those mechanical cupping sets that's you suction cup, and he might actually be addicted to it. I think that the feeling of that pull on the body and then the release, it's just like, so lovely. So that's our shares.
Awesome. Thanks so much. All right, so we've got a lot to cover today. We're gonna go over an integrative approach and disease versus health balance. We're going to talk about what is regenerative medicine. We're going to talk about what happens when we injure ourselves, what causes chronic pain and dysfunction, how do we assess. We're going to talk about inflammaging and all the pillars. We're going to talk about fire retardant or propane. How do we make our biologic systems work for us and not against us, specifically looking at our immune and nervous systems. We're going to talk about some treatments we can do at home, including peptides, hormone replacement therapy, supplements, detox and gut protocols, using biofeedback devices. And then we're going to spend a good portion of our time talking about all the cutting edge treatments in the office, including the regenerative treatments, stellate ganglion blocks, ketamine, ozone, Shiftwave, Joov, and IV therapy. And at the end, we'll go over any questions that we have time to go through. So if you can just put your questions, as Jen mentioned, in the Q&A or in the chat box, we'll get to as many as we can at the end. And if there are any that we don't get to during the webinar, we can send an email with responses after. What we're not going to explicitly cover today is how to treat specific injuries or specific painful conditions. And we're also not going to do an in-depth discussion on peptides. That's going to be coming in a webinar coming up soon. And I'm also not going to do a big data review of the treatments. We'll talk a teeny bit about data, but too much to cover to get into all the data today. So the first thing I'd like to talk about is the integrative approach and disease versus health balance. And for those of you who've listened to webinars before, I always kind of start out discussing what integrative medicine is, because a lot of people don't really understand what it is. So first of all, it's evidence-based, and it's the umbrella under which all forms of healing modalities with evidence lie. So under the umbrella of integrative medicine is conventional medicine, sound healing, regenerative medicine, naturopathic medicine, chiropractic medicine, energy medicine, Chinese medicine, Ayurvedic medicine, osteopathic medicine, massage, et cetera, et cetera. And the important thing to know is that everything we do is evidence-based. Now, it might not be huge randomized controlled trials. It might be a case report, but everything that we do has evidence. So it's not, I think sometimes people confuse integrative medicine with not having evidence, and it does have evidence. All right, now we're going to just talk briefly about 35,000-foot view of disease versus health. And we talk about this a lot in our integrative appointments. It's really just, looking at, is your biologic system stronger than all the internal and external stressors? And if it is, as you can see in this little seesaw, then you're going to be in health. The biologic systems are all of our systems in our body, and the stressors are all the internal and external stressors that impact us. If we flip in the other direction and the internal and external stressors outweigh our biologic systems, then we go into a state of disease. One thing that is important that in terms of our approach is we look at everything holistically. So in conventional medicine, which I worked in for many, many years, we would divide up everything into parts. So if something was going on in your head, if you have a sore throat, maybe you go to the ear, nose, and throat doctor. If you have something going on in your knee, you go to the orthopedic surgeon. Of course, everything is all related. And when we look at kind of this seesaw, and I'm also going to talk about a bathtub model in a second of disease versus health, it makes sense that we need to think of the whole body as a whole, because it is, and not little divided parts. So if we look at the model of our body's biologic capacity as a bathtub, so the bathtub here is the capacity of all of our biologic systems. And then the water coming in is all the internal and external stressors coming in. And the drain is our body's ability to detox, or basically get rid of stressors. And all the stressors are the same that I was just talking about, all the different things that can impact our body. So it can be things like emotional stress, but it can also be things like deficiencies in vitamins, it can be infections, it can be microbiome imbalance, it can be toxins, it can be not getting enough sleep. And then all the biologic systems are all the systems that are needed to be healthy and strong. Now, if we look at the bathtub model here, if we end up having too many stressors coming in, then we're going to end up overflowing the bathtub. So if you look in the upper left-hand corner there, maybe a disrupted microbiome keeps your bathtub half full. And then you add some chronic stress on it, and all of a sudden it's getting up there. It's pretty close to being full, but you still feel okay. You're not really having symptoms. And then you get COVID on top of it, and then all of a sudden it's overflowing. And that's what we saw a lot with COVID over the past couple of years, is people were feeling fine, or they thought they were feeling fine, and then they get COVID, and suddenly they end up with long haul COVID. They're sick for long periods of time. They don't understand why. And it's because their bathtub was almost full when they got COVID. So anything, our approach looks at what can we do to make the bathtub bigger. And there's lots of ways we can do that, including things like ozone therapy, fasting, cold therapy. There's lots of things that we can do to help with the detoxing to make the drain work better. And then there's lots of things that we can do to try and shut down the amount of internal and external stressors coming in. So that's kind of big picture how we look at it. And it's important to note that your body is way smarter than any of our brains. So your body wants to be in balance. And if you give it what it needs and take away what it doesn't need, it's going to get in balance, and magic happens. And then you feel good, and you can get back to doing all the things that you love to do. Let's zoom in a little bit here, get a little bit more specific. So these are the 7 pillars of health that I like to talk about. And I've done webinars on a bunch of these already. But basically, you want to make sure that you have balance and health in all these different areas. And if any of them are out of balance, if you're not addressing any of them, then that whole seesaw or the bathtub model is the bathtub's going to overflow, or the seesaw is going to tip towards disease. And then the other thing that I just want to mention as well is that the mind is so important in terms of our health as well. So there's lots of books out there. These are just a few talking about the metaphysical causes of disease, but basically where our thoughts go is where our reality happens. And so if we're not thinking positively, if we're thinking we're not going to heal, we're much less likely to heal. There's lots of studies that have happened on cancer patients, for example, where patients who believe that they're going to heal actually do a much better job of healing. So as much as possible, implementing a positive mind-body practice is super helpful as well. And then also just to mention that what we do in the office is really only about 10% of it. And what you do on your own is 90% of it. It's really a collaborative effort. And the health coaches are super important to help you with that 90%. And it generally takes about 2 to 5 years to get the body back in balance. And that just depends on your time, your motivation, your resources, where you're starting out. A lot of times people start feeling a lot better, and then they don't want to kind of continue with the process. So it just depends on how much effort you put into it. And remember, if you're in your 40s or 50s, it's taken you that long to get out of balance. So 2 to 5 years to really get back into a healthy state of balance is pretty amazing. And that's way better than taking chronic medications for the rest of your life. All right. The next thing we're going to jump into is, what is regenerative medicine? So regenerative medicine's been around since the time of the gladiators. So in the gladiator time, what they would do is, if a gladiator, for example, tore a rotator cuff and it wasn't healing well, they'd actually take hot pokers and put it into the damaged tissue to kind of re-injure it and stimulate the body, send signals to the body to heal itself. And that's basically all we're doing with regenerative medicine. We're helping to signal to the body to heal itself. And we do it in a lot more sophisticated ways than sticking a hot poker in. But at the end of the day, that's all really that we're doing is sending signaling molecules. Our body has stores of stem cells everywhere. And then when we signal to the body, hey, this isn't really healed completely, it sends the stem cells to that area and heals. Lots of treatment options, and regenerative medicine can kind of help. We're talking today more specifically about pain and injury, but regenerative medicine can help all throughout the body. And it's really just an infancy in terms of the potential. I think we're going to see more and more of it in terms of the capacity to heal our entire bodies. Today, we're going to look at it more through the lens of musculoskeletal injuries and pain and injuries. And this is just a quick slide looking at examples of a lot of the things that we can help with regenerative medicine. It's pretty much, regenerative medicine can pretty much help any sort of painful condition or any injury. All right, let's just talk briefly about what happens when we injure ourselves. So initially, if we injure ourselves, there's going to be bleeding. Even if we don't have an open cut, even if it's like a closed fracture, there's bleeding inside there. And then that's going to last for just hours. Obviously, if we bled for more than hours, then we're not going to be able to keep living. Then we go into the inflammatory stage, which lasts from days to weeks. Then we go into the proliferative stage, which lasts from days to months. And then we go into the remodeling phase, which starts at weeks and goes to months. And the reason I want to kind of point this out is that it takes a long time to heal. So if any of you have ever had a broken bone, you get a cast or a splint put on, and then it's usually about 6 weeks that you have to have that on. And that's about the time in general with healing that we get to the point where we don't have to have that support anymore. And it's mostly healed, but things take a long time to get completely healed. And this is just another diagram kind of showing the different processes here and how long it takes. But I wanted to show that remodeling can take really up to 2 years, which is quite a long time. So I think a lot of times the pain goes away and people feel like, oh, I must be healed, or maybe the pain stays. But either way, it does take a long time for complete healing. And part of what we're doing with regenerative medicine is trying to speed that up. And then another thing to comment on is, ligament injuries, tendon injuries, muscle strains. A lot of these can take up to an entire year to heal. And so depending on how severe the injury is, and that's important in terms of expectations for the treatments that we're doing. We're trying to speed it up, but really all we're doing is helping the body to heal itself. So we can only speed it up so much. You still have your body. And we want to make sure that we're doing everything that we can do to support the body healing itself. All right. What causes chronic pain and dysfunction? So first of all, I just want to mention that pain is a huge problem. Okay. So 34% of people at age 30 have pain, and 88% of people at age 75 have pain. So it's a huge unmet need. And the 4 main causes of almost all chronic pain are ligament laxity, manifestations of joint instability, neurogenic inflammation, and nerve entrapment. And something that I think I missed in my conventional training is really the importance of nerves. And a lot of our treatments really focus on getting the nerves working better. So there's different types of nerves. There's the myelinated and the unmyelinated nerves. The myelinated nerves are basically like the sheath that goes over a cord. It allows more signals to travel faster. So that's like, you know, if you touch something hot, your hand comes off really fast. That's because of the myelin, and the nerves travel really fast. Chronic pain, however, travels in unmyelinated nerves, and it works a little differently. And most of the time, what we're addressing is chronic pain conditions. So it's a different approach. Nerves need to have a constant energy supply. If they don't, they start to get pain. If you imagine, like, you took your finger and you put a rubber band around it and you cut off the circulation, eventually it would start to hurt. And that's from the nerves. That's from those nerves getting inflamed, not getting enough oxygen, not getting enough glucose. Nerves are particularly sensitive to not getting enough oxygen and glucose. And this is helpful for us to know in terms of how we treat nerve pain. So glucose, which is basically sugar, is the most important thing for nerves. So when they've done studies, the C fibers are the nerves that cause chronic pain and travel slowly and are unmyelinated. So when they've done studies comparing, like, what happens if we deprive these nerves of glucose versus oxygen versus lactate, or put it in an acidotic environment, and they're the most sensitive to having glucose taken away from them. And so for that reason, all of our injections that we do, we include glucose, or we use dextrose, actually. So we use a buffered dextrose with all of our injections to help give the nerves what they want. And we'll talk more about how we actually treat the nerves a little bit later, but it's important to realize how important that dextrose is. And then oxygen is super important as well. And then what ends up happening when they don't get the energy that they need, when they don't get enough glucose, is the nerves fire more, they release a lot of inflammatory neuropeptides, and it causes neurogenic inflammation. And the way I think of that is, like, imagine if this cord that I'm using for my headphones is a nerve, and the nerve is flowing in between the fascia, and the fascia is basically the layer, the smooth layer that allows the muscles to move without getting stuck. If that nerve gets swollen in there, it's going to get stuck, and then it's going to get swollen in both directions, and then it's going to release more and more inflammatory neuropeptides, and it's going to cause more and more pain. And then the other thing to think about with nerve pain is that when you get disruptions in the tight junctions, you basically get leaky nerves, which we talk about leaky gut and leaky brain, and leaky nerves cause a lot of pain as well. So when you have leaky nerves, that's also going to cause leaky gut, because the vagus nerve is the largest nerve in the body, and it connects your central nervous system to your enteric nervous system, which is your gut nervous system. And so if your gut is inflamed, we talk about this a lot, that's going to cause increased pain throughout your body. So if you imagine a little dial on pain, if your gut is inflamed, that's going to turn up the dial on the pain throughout your body. If your gut inflammation is down, it's going to turn down the dial. And it's all about basically permeability, leaky gut, leaky brain. And we could spend hours talking about this, but suffice it to say that the nervous system is causing a lot of pain for people if it's out of balance and it's inflamed.
Yeah,
All right.
Dr. Okay, there was this one interesting thing I read about SIBO, about how small intestine bacterial overgrowth is commonly the cause of fibromyalgia. And so just really connecting like a gut pain syndrome, that's a lot of people would think just look in their gut when they have pain in numerous locations of their body.
Yeah, 100%. People come in all the time wanting, help with their shoulder, and we end up talking about what's going on with their poop, and they a lot of times kind of scratch their heads wondering why, but it's so important. Thanks so much for mentioning that. So how do we assess this? The first thing that we always do, if speaking of coming in with shoulder pain, if you're coming in with shoulder pain, the first thing that we're going to do is do an integrative telemedicine visit. And that's before we even see you for the visit, we're going to ask you to fill out about 3 hours of questionnaires. And that's a lot. And the reason for that is we want to really zero in on what are the root causes. We don't want to just band-aid what's happening. So, we can do things like cortisone shots or put nerve blockers in there, which is going to temporarily help the problem, but it's not really getting to the root cause, and it's going to come back. And so by having you do the questionnaires, we can see everything that's going on beforehand and kind of address things like the gut toxins, all these things that we were talking about. And then when you come into the office, we do a diagnostic ultrasound to look at what's happening with your nerves, with your tissues, and then we talk about treatment after that. when we're looking at the questionnaires, we're always looking at it through the lens of inflammation, and we talk about inflammaging. Anything that causes inflammation is going to increase your aging, and it's also going to increase all the diseases of aging. And then we're always looking at everything through the lens of all the 7 pillars of health. So if I have someone coming in and they have shoulder pain and they have a real long history of PTSD, they're stressed, they're not sleeping well, they don't ever exercise, we're going to have trouble getting that shoulder to heal. And I think of it as like, if we're planting seeds, if I think of, all of our regenerative treatments as planting seeds, if we're planting seeds in the desert soil, they're not going to grow really very well. So we want to have healthy soil, and that's a healthy body when we're doing the treatments, and everything's going to work a lot better that way. Okay, on that note, fire retardant or propane. So the two systems, and I already mentioned the nervous system a little bit, the two systems that are kind of the most important that we want to address in terms of pain and injuries is the nervous system and the immune system. And most of the immune system is in the gut. So when we talk about the nervous system, we want to most of the time be in parasympathetic, which is rest and digest. If we're in sympathetic, which is flight, fight, we're not going to heal well. Can imagine if a bear runs into your room right now, you want all of your blood to go to your extremities so you can punch the bear in the face and run out of there. And you better believe that when your body's doing that, it is not working on healing, your chronic shoulder pain. It's not working on putting blood in your gut so that you can produce optimal hormones. And most of us, unfortunately, especially after the past 2 years, are out of balance, and our sympathetic nervous systems are ramped up and our sympathetic nervous systems aren't in balance. We talked a little bit about the leaky gut, leaky brain connection, but I think this diagram shows it pretty well that as we have permeability in our gut, it's going to ultimately, or can ultimately, lead to autoimmune disease. When we have autoimmune disease, we get things like breakdown in cartilage, which can cause chronic pain, rheumatoid arthritis, osteoarthritis, things like that. So again, this is why things like the gut are so important to pain and injuries. All right. Next thing we're going to talk about is treatments at home. And we're not going to spend a ton of time on this, just kind of mention, and we can certainly chat with you all about more specifics, but addressing all the causes of inflammaging, lots of protocols that we do to get the gut in balance, to help detox your bodies, hormone replacement therapy, things like peptides and NAD we can do at home. And on the reason I put this diagram again is you can see that TB4 is thymosin beta, which is a peptide that we like to use to help healing. And you can see on this diagram to the right that thymosin beta 4 is highlighted a few times. Supplements like curcumin and phytoprofen help to decrease pain. And then I always like using biofeedback devices so that we can get some real-time data on how things are going. So the Oura Ring, the Whoop, Garmin, there's all sorts of biofeedback devices that'll look at how your sleep is, how your recovery is, what your HRV is. You can then put it into apps that will tell you how much you're in parasympathetic and sympathetic. But basically, you can use that to dial your behaviors to optimize your healing. And if you're doing too much and your heart rate variability goes down, for example, you can change your behaviors so that you're staying more in parasympathetic. All right. So the next thing we're going to jump into, which is going to be the bulk of this presentation, is talking about all the different treatments that we can do to help get your body feeling better faster. So the first thing we're going to talk about is regenerative treatments. And for those of you who have ever heard me talk about this, we have tons of different options ranging from the low end. There's shockwave therapy and PMF, which maybe increases your healing 10 times versus not doing anything. And then there's PRP, ozone, hydrodissection, PIT, maybe that's 100 times. And I want to note that these are not the exact numbers. I'm just saying it is exponentially better as we start to get products that are derived from the cradle of life, but these are not the exact numbers. This is approximate, but it is a much higher impact when we use the cells that are derived from the cradle of life. So 1,000 times for autologous stem cells. I'm going to talk more about what all these things are. And then 10,000 times for things like Wharton's jelly, exosomes, placental matrix, and mesenchymal stem cells. So I think of it as really all these things are just signaling to our body to heal itself. So maybe you injure yourself, you don't do anything, and your body's not getting any signal that it needs to do anything. And then for the ones that increase it 10 times, maybe it's a whisper. So you know, your body, the signaling molecule says like, hey, immune system, come help. So it's signaling to your immune system to come help. And then 100 times, maybe someone's speaking like, hey, immune system, come help this area. And then 1,000 times someone's speaking with a microphone. So it's having more impact. And then 10,000 times it's like speaking with a megaphone. So it's really like, how strong are these signaling molecules in telling your body, hey, you need to come and heal this area. And again, like imagine I hurt my rotator cuff 5 years ago, and my body just got to a point where after probably a few months where it was like, this is good enough. I'm not a professional athlete. It's fine. But I have chronic pain and dysfunction, and my immune system has just kind of decided that it's fine the way it is. And this happens all the time, that we end up with chronic pain and injuries. And so by doing these treatments, it's sort of re-signaling to the body, hey, you're not actually done healing this. Come back and do some work and get this healed. The only downside, I think, for doing the treatments that are kind of 10,000 times more powerful is they do go up in cost. So, you know, the ones where it's like a whisper, shockwave therapy, and PMF are much less expensive. And when we start doing the stem cell and placental matrix, those type of products are more expensive. And I'm going to talk more about this, but that's just of note, like, why wouldn't we always jump to the ones that are more effective? None of this stuff at this point is covered by insurance, and that's something that hopefully over time is going to change, but that's just kind of the world we're in now. Some of the nerve treatments are starting to be covered as well as PRP, but in general, it's not covered. And then I just also wanted to note that in our clinic, anytime anyone does any of the regenerative injections with any of those more expensive products, we do include shockwave therapy, hydrodissection, ozone, PIT. We include all these other treatments with it. So we always try and do everything we can to optimize healing. And that's also why we have the hour-long regenerative or telemedicine integrative appointment first, is to make sure that we're addressing all the foundational things so you heal better. Okay, so the whisper level is PMF and shockwave therapy, and I'm just going to spend a couple of minutes chatting about them. So this is our PMF machine in our Victor office, and basically what it's doing, it's charging your battery. So if you imagine that each cell in your body is like a little battery, and if the batteries aren't charged, you can't heal. That's basically what this is doing, is charging your battery. So the bed on the bottom is all connected, and then we have different pads that we put on your top or around joints to charge specific areas. And I think of it as kind of like it jump starts healing at the cellular level. So if you don't have that energy, it's going to be really hard to heal. And so it's kind of like putting tiny jumper cables onto your 50 trillion cells. And then of note, there's a ton of evidence out there on PMF. And we know that the less charged we are, the less charged our cells are, the more likely we're going to be sick. And then the more charged we are, the more likely we're going to feel better. So the PMF machine is something that I try and lie on as much as I can when I'm around the office. It really literally feels like I'm charging up my batteries. Like I leave it feeling way better. So implementing that in any sort of treatment is helpful. It also helps with detox. We talked about the bathtub. It's going to kind of help your capacity to be bigger, and it's certainly going to help with pain and injury recovery. The next kind of low-hanging fruit, non-invasive therapy is shockwave therapy, and it's basically using sound waves to stimulate things like growth factors. Angiogenesis means like more vessel formation, anti-inflammatory. It helps cells to proliferate. It's going to help with stem cell differentiation to the area. So, if you injure your shoulder and we do the shockwave therapy there, it's going to help recruit stem cells there and turn them into whatever sort of tissue is damaged. So it's super effective. The sooner that we do it after an injury, the more effective it is. We try and do shockwave therapy before we do injections, and then include a series of shockwave therapies after the injections. Sometimes if the injury is not too bad and it's more recent, shockwave therapy alone can heal the injury. All right, now if we go up to 100 times, that's like someone.
We just had a question on shockwave, if you didn't mind me interjecting while we were there.
Sure.
The question was, does it hurt?
No, shockwave therapy it feels like just like a little, kind of a little tapping. It doesn't hurt very much at all. Good question. And maybe let's just leave, unless it's really important, let's leave the questions until the end just so we get through everything. Thanks so much. So the 100 times increase here is just like speaking. So it's basically like the signaling molecules are saying to the immune system, like, hey, get over here and help. But it's not sounding the alarm yet. So the therapies that are in this category are PRP, ozone, and nerve treatment. So the nerve treatments that we have are lift-off perineural injection therapy and hydrodissection. We'll talk about both of those. So PRP, probably a lot of you have heard of that. It's basically platelet-rich plasma, and it has a lot of growth factors. So again, the growth factors are what are going to stimulate your nervous system and your immune system to heal yourself. It also provides a matrix for healing. It includes hemostasis, which basically is reducing bleeding, and it also has some anti-inflammatory and antimicrobial properties. The way it works is we take your blood out of your arm, and then we're going to spin it down to take the platelets out, and we're going to take the platelet-rich plasma. You can see the little layer in that diagram, and then we add ozone to it and then inject it back into the joint or whatever's injured. Ozone therapy. So, and actually one quick comment on PRP. So PRP, we're using your own platelets. So depending on the age and how strong your platelets are, how many platelets you have, it might be more or less effective. So that's something to keep in mind. If we're doing PRP on like a healthy 20-year-old, it's probably going to be more effective than an 80-year-old who has chronic illness. Okay, ozone injection. So ozone's basically activated oxygen, and I'll go over in a minute how it's produced. But this little diagram just shows another diagram of how much pain is a huge issue. So 27% of Americans suffer from back pain, 25% from neck pain, 19% from joint pain. And ozone is just really helpful because it helps to strengthen the bones, tendons, muscles. It also helps to boost the immune system. It kind of gets to the root cause more, like we've been talking about. It improves circulation. It's a pain reliever. It improves tissue oxygenation. It's an antioxidant. It's an immune system stimulant, and it's a germicide. So lots of benefits to ozone. And this is interesting, I think, in terms of like we use ozone therapy as well to help with chronic infections and mold. And it kills 99% of bacteria, fungi, yeast, and mold and viruses in 10 seconds, which is 3,500 times faster than chlorine. So of course there are ozone machines for water, but we can also use it to help to get your immune system in balance and kill chronic infections in your blood. And by ozonating our injections, it also really significantly decreases the chance of having any sort of infection from injections. All of our injections, all of the solutions that we use are quite anti-inflammatory and also antiseptic. So very unlikely to get infections from the injections. This is just looking at how is ozone formed. So you have an oxygen molecule, which is O2. You electrify it with electricity, and we use it. We have a little generator, but the smell that you smell in electrical storms and lightning storms, that's actually ozone. So then it turns it into O3, and that's the one with the two black molecules in the blue. And then it's like a supercharged oxygen, basically. And then that's going to help to kill microorganisms, and it's also going to bind pollutants and help get them out of your body. And then it's going to turn back to oxygen. So it's kind of a way to super oxygenate an area and help detox. It also helps to balance your immune system. And we'll do a webinar just on ozone coming up. All right, the next thing we're going to talk about is nerve treatments. So the first type of nerve treatment, which we use very teeny needles, you can see on that upper right-hand corner, is lift-off perineural injection therapy. And that man in the bottom with me is Dr. Liftoff. So he's a sports medicine doctor from New Zealand who kind of termed this way of doing things. But basically it goes back to that fact that if nerves don't have enough dextrose, they're going to cause pain, they're going to get more inflamed, they're going to get more leaky. And the nerve, that little diagram there with the nerve, on the right side is kind of what a normal nerve diameter should be. In the middle is a really swollen nerve, and on the left is a really stretched nerve. So whenever the nerves are not functioning normal, we're going to have pain. And so that's why a lot of people will have surgeries and then they still have pain after, because surgeries almost never address the nerves unless it's specifically to release a nerve. But most of the time surgeries are addressing the the tendons, the ligaments, the joints, and they're not addressing the nerves. So by doing these treatments, I'm going to talk about a little bit more. It helps to correct the little miniature compartment syndrome where the nerve is really swollen. It helps to stimulate nerve repair. And this is kind of a diagram of where we're treating. We're treating that little web of nerves that's between the skin and the nerve trunk. So the big nerves in our body all have these little subcutaneous nerves that go up to the skin. So, and the way we do the treatment is we actually feel where people are having pain, and then we put a little teeny needle, it's like a 30 gauge insulin type needle, into the skin, and it basically infiltrates that area with that web of nerves. And when we do teaching for this, we'll actually draw a line so you can see where those little circles are. We call those the Biofeedback points, which is basically areas where people have pain. So I will palpate along the nerve and see, hey, where is this hurting? And the areas where it hurts is where the nerve is probably getting entrapped and inflamed, and that's where I'm going to inject. The areas where it hurts is usually areas where it's going to naturally get stuck just based on anatomy, or where people have had injuries. And you can see this diagram on the right. It's really just going into the subcutaneous layer. It's not going deep. And on a kind of more biochemical level, what the perineural injection therapy is really doing, it's restoring the function of one of the receptors on the neurons. And then once that function is restored, then the nerves can help restore the tissues. So I think of it as like, similar to like we need to charge our batteries, the nerves are what are sending messages to our immune system. It's like our communication system to heal the tissues. So if the nerves aren't working properly, things aren't going to heal. So if you imagine you have chronic knee pain, maybe osteoarthritis of your knee, just by treating the nerves and getting those working better, the pain is going to improve. And we've even seen cartilage grow back just from treating the nerves, not even doing anything into the joint. So we always include nerve treatments with any of the regenerative injections. The next thing I'm going to talk about is hydrodissection, which is treating deeper nerves. So if you've got, shoulder pain, the pain might be from something that's happening in the shoulder. It also might be nerves that are up in the neck, for example, that are pinched. So the nerves usually flow, the big nerves flow along with veins and arteries, and all sorts of things can cause them to get entrapped and squished, and then they become painful. So if you look at this diagram or the ultrasound image in the bottom, the circle in the middle is the nerve, the black around it is the fluid that we inject around it, and then that white line is the needle. And then the diagram at the top is kind of showing basically what we're doing. So we're putting a needle around the nerves, not into the nerves, putting fluid around it to release those nerves. And then once the nerves are released, then they're going to work better. They're not going to be swollen. They're going to feel better, and they're going to send signals better. So the combination of doing the deep nerves with those superficial nerves oftentimes is quite effective for getting people's pain and injuries improved. We think about pinched nerves all the time. People a lot of times will say, oh, I have a pinched nerve. My disc is herniated, so I need to have surgery. A lot of times what we can do is hydrodissect that pinched nerve, and then when the nerve is feeling better, it'll help heal the disc, for example. And we can also inject the disc with regenerative products to help the disc to heal. So a lot of the treatments that we can do can really avoid having invasive procedures like surgeries. And then this is just another picture of a hydrodissection, and everything that we do is ultrasound guided. So a lot of people get what's called piriformis syndrome, and that's kind of pain down in the butt area. And what we can do is we can actually put fluid around the muscle. So sometimes the hydrodissection is around nerves, sometimes it's around the muscle as well. Around the muscle is the fascia, and in the fascia, there's always little nerves. So by releasing that helps as well. We can't do these deeper with the injection because it's superficial. We use teeny needles, and we don't use the ultrasound. For the deeper ones, we use the ultrasound to make sure that we're getting to the right spot. All right, continuing on with regenerative treatments here. So the treatments that are maybe like a 1,000 times increase are using our own stem cells. So we can get our own stem cells and use them therapeutically from our bone marrow or from our fat, and basically can put like a trocar into our pelvis to pull out the bone marrow, or we can do basically liposuction to get the fat and spin it down, and they get the stem cells out of there. Really, it's just signaling molecules. All of this is really just signaling molecules. Most of it, probably by the time we inject it, not too many of the stem cells are live. Some of them will be. Important thing to consider with this treatment, similar to the PRP, is how old is the patient. So if you're taking a 20-year-old and using their stem cells, it's going to be way more effective than an 80-year-old. And then when you compare these stem cells to the amniotic and placental products, they seem to be less effective, and it ends up being about the same price, and it's way more invasive. So I got this done on myself a few years ago for my knee, and I was like bruised and in pain and couldn't do anything for quite a while. So it's not a small undertaking, and I've gone through all these things. My journey with this started with my own knee injuries several years ago, and so I've gotten all these treatments done, and for sure the ones that are derived from the cradle of life seem to be more effective. And I'm going to talk about those now. So the stem cells, the mesenchymal stem cells, which are basically derived from the cradle of life, that's like a megaphone to your immune system being like, hey, you need to get here now and fix this area. And the four things that we're going to talk about are mesenchymal stem cells, exosomes, Wharton's jelly, and placental tissue matrix. So mesenchymal stem cells are basically, you hear about stem cell therapy. The only stem cell therapy that's legal in the US is taking your own bone marrow or cartilage and spinning it down. Taking stem cells derived from the embryos, basically, and there's never, and just to be clear, there's never any abortions or anything like that happening. The stem cell, they're from live births that are donated placenta, donated amniotic fluid, not embryos. But it's illegal in the US, and it's legal in other places, but basically these cells can differentiate to any type of cell in the body. So super amazing potential. There's a lot of kind of amazing stories around the world with these being used, and really heroic healing that's happening, but it's still not ready for prime time for various reasons. So what we use are the little exosomes that are secreted by these stem cells. So they're the signaling molecules, and then those can signal to various parts of the body to produce more blood vessels, to reduce inflammation, to help the immune system, to produce more tissue formation, depending on what we're looking for. Exosomes are way smaller than cells. So they're little teeny molecules. They don't have DNA in them. It's just messenger RNA. The Pfizer and Moderna vaccines are both basically exosomes. So they're little signaling molecules that signal to our bodies to heal themselves. And when they've tagged exosomes that are injected, say IV exosomes, they seem to know to go to where damaged tissues are to recruit your own stem cells to go to that area. All cells have exosomes. So we can also, cancer cells, for example, have exosomes as well. So one of the emerging technologies to kind of see early detection of cancer is to check our blood for, say, pancreatic exosomes or prostate cancer exosomes. So what we're talking about is exosomes that are derived from mesenchymal stem cells. So those stem cells that can differentiate into anything that are from scheduled C-sections and amniotic fluid. So basically the cradle of life. Imagine a baby cutting themselves versus an 80-year-old, the baby's just going to heal better. And a lot of that is because of those signaling molecules. So we can inject these, they're called extracellular vesicles with growth factors. We can inject them into joints, and it's going to help with proliferation. It's going to help with modulation of the immune system. It's going to help to prevent cell destruction in that area in terms of breakdown of cartilage, stuff like that. It's also going to help migrate stem cells to that area. It's naturally anti-inflammatory. It's naturally antiseptic as well. So this is just another diagram showing like all cells have exosomes. The exosomes are these little signaling molecules that get released and that then get sent to recipient cells. And when we use them therapeutically, the idea is that the exosomes signal to the cells to heal themselves and to also recruit other stem cells. This is just another diagram showing it. It's just messenger RNA and proteins in there. There's no DNA in there. So that's one of the problems with using live stem cell treatment is the DNA, or one of the concerns about that. All right, the next thing we're going to talk about is Wharton's jelly. So Wharton's jelly is basically the stuff that lubricates and supports the umbilical cord. And it actually does contain high levels of mesenchymal stem cells. And it's anti-inflammatory. It has hyaluronic acid and collagen, which lubricates cartilage. It has a lot of growth factors. And the Wharton's jelly that we use is derived after rigorous screening from the cord donated by a healthy mother of a full-term baby. And this is just another little picture showing that the Wharton's jelly mesenchymal stem cells can then differentiate into all different types of cells. And we use acellular Wharton's jelly. So we're not, again, we're never injecting, it's illegal in the US to inject live cells or to inject cells with DNA unless they're derived from yourself. All right. The next treatment that we use is something called placental tissue matrix. So it's kind of what it sounds like. It's derived from placentas, from scheduled C-sections as well. Anti-inflammatory, antimicrobial, it's an antioxidant. It's going to help blood vessels to grow. It's going to help bone to grow. It's going to help nerves to grow. It doesn't cause an immune response, and it helps with structures. So exosomes aren't really good at staying in a place. If we want, say, if cartilage is broken down in the knee and we want to make sure that the product stays there, we want to use something like placental tissue matrix or Wharton's jelly, which will stay there better than exosomes. Oftentimes we add exosomes into the mix to help with the inflammation more. This is a little chart just kind of showing the benefits, pros and cons of placental tissue matrix with PRP, with hyaluronic acid, with cortisone, with bone marrow and fat stem cells. So you can see that the placental tissue matrix has a lot of growth factors. It has a hyaluronic acid already. It has a collagen scaffold. It's a complete tissue matrix. And there's no known adverse side effects. It usually, we can get away with one treatment with this or with Wharton's jelly versus PRP oftentimes takes several. Cortisone is really just a duct tape, as probably many of you know, and it suppresses the immune system. And then it's not invasive. So it doesn't require recovery in other parts of the body like the fat and the bone marrow do. And this is just one, they've done lots of studies on these. It's still, in the infancy, but this is just looking at, injection into a joint capsule with control versus matrigel versus placental matrix. And placental matrix, there's way more vascularization. This was actually done in an animal versus the control versus a matrigel, which is something that is used with in veterinary medicine. This is a diagram of one of the products that we use looking at pain reduction after injecting placental matrix for foot and ankle tendon. And you can see that it does significantly decrease with using the placental tissue matrix. All right, the next thing I'm going to talk about briefly is just the other treatments that we can use in the office to help with pain and injuries. I'm not going to spend a ton of time on this. We've done a lot of talking about stellate ganglion blocks, and it's basically an autonomic nervous system reboot. So I think of it as, if you have your computer and you have a spinning wheel of death from too many apps being open, you can reboot the computer. It closes anything that's not necessary. And then when it opens up, things work better again. So the same thing happens with the nervous system. If it's out of balance with parasympathetic and sympathetic, it's an injection in the neck. We have a couple webinars, lectures on our website about it if you want to learn more. But basically, when you get your nervous system in balance, it's going to help with your pain and it's going to help with your recovery. I think of it as like a little dial. So when your nervous system is upregulated, you're going to be in more pain. When it's downregulated where it's supposed to be, you're going to be in less pain. So anything that's going to regulate the nervous system is going to be helpful. Certainly things like mindfulness, meditation, all those things will help as well. But a stellate ganglion block is like 10,000 hours of meditation. It just gets your nervous system into balance way faster. We also block the vagus nerve when we do that. And the vagus nerve, again, is the longest nerve in the body connecting the enteric nervous system, which is the gut's nervous system, to the central nervous system. And when the vagus nerve is not balanced, we're not going to be able to heal well. So we get both of those at the same time. And then that also helps if our gut is super inflamed, that's going to help calm that down. And important to note, though, that we still need to address what's happening with the gut microbiome as well. Ketamine therapy is super helpful for pain. That's been used. I use that in the ER all the time for pain prior to moving into the integrative space. We do drips that are 80 minutes long for chronic pain. We do 40 minutes for depression. A lot of times, to be honest, the depression dose helps with pain as well. So I always start with a lower dose and see if that works. It increases GABA, which is the chill out neurotransmitter, and decreases glutamate, which is the most excitatory neurotransmitter. And doing it IV makes for a really smooth experience. It's more predictable and it's more bioavailable than doing oral or intramuscular. And the data is on doing 6 strips over a period of 3 weeks. So combining ketamine with stellate ganglion blocks for pretty much any sort of painful condition, if we just did that and didn't even address whatever is hurting, that just going to turn the dial down. A lot of times people's symptoms go away. Other treatment options that we have in the office, we have infrared panels, which are great for inflammation and healing. IV nutritional therapy is a way to get vitamins and minerals amino acids that we need into us directly. If our gut is inflamed, it's hard to absorb all those important nutrients. The Shiftwave chair is a vibrational chair that helps get your body more into parasympathetic versus sympathetic. And then multi-pass ozone therapy, we'll talk about that more, but it helps modulate the immune system so that the T helper cells are more in balance, and you're going to heal better with that, just through the lens of pain and injury. Okay, so that was a lot that we covered. I'm curious now, what is something you can do to decrease your chronic pain after listening to this webinar? If you can just put that in the chat box.
So somebody wrote, go to boost. Another person wrote to get your gut in order.
Nice. Awesome.
And another thought is an integrative consult, doing a virtual consult with you and a supportive coach to really personalize that path of your treatments. There's so many great tools here. People are probably wondering, well, which one makes the most sense for me? And just like we personalize care plans for a chronic illness, we personalize care plans for chronic pain. So to do that integrative consult and to not only improve your pain, but to improve your general health and physiology, it's a win-win.
Awesome. Yep, for sure. Yeah, and I think that's such an important point, that a lot of times the treatments in the office aren't even necessary. A lot of times as people are waiting to get their appointment, for say their shoulder, and they're working on their gut, things improve just with that inflammation going down. So it's a great point.
Another comment was to reduce stress and stimulate the parasympathetic nervous system.
Yes.
Answer.
So good. Yep, I love that. What questions do we have?
Yeah, one of the questions that came in was around the PEMF, and very specific though. If it's a new injury, if it's pretty acute, is it okay to get a PEMF treatment? Yeah,
absolutely. Yep, it's discharging your cells. You might need to have you might need to have the settings a little lower because it could be more painful, but totally. That's shockwave and PEMF you can do right away. Good question. And I've done that many times where I just tweak something and then I put those things on and it just goes away.
Awesome. A question about when do you foresee stem cells being approved, and what would you recommend if someone wants to get injections now?
Yeah, good question. So that's like the, billion-dollar question in regenerative medicine. And I don't have a crystal ball on that one. My suspicion is the direction this is all going to go is that, big pharma is going to take over these products, and then they'll pay. Part of the reason that they're not approved right now is we need huge trials to approve them, and huge trials are really expensive. So, a big company like Pfizer or Merck or something like that will take it over, probably take over some of these smaller companies and then pay for the huge trial. When that is going to happen, I'm not sure. I think things are definitely moving faster than they would have been had we not just had the pandemic. That's really sped up the whole process. And, again, it's all signaling molecules. So even doing the live stem cell treatments that you can get in places like Mexico, a lot of the times, by the time they take the stem cells out of the donor and put them into the recipient, the cells are not alive anymore. So a lot of the times it's still just those signaling molecules that are still alive. So a lot of the treatments that we have, as I just went through, are excellent at signaling to your body to heal itself. So in lieu of having those treatments, the Wharton's jelly, the exosomes, the placental tissue matrix, and adding ozone and the nerve hydrodissection onto all those are super effective. And then the other thing to note is with all these treatments, there unfortunately are a lot of people out there who are doing injections without image guidance. So, if you put stem cells into a knee, but you don't have an ultrasound, there's a good chance you're not actually going to get it into the knee. They've done studies looking at orthopedic surgeons who, have done joint injections their whole career blindly without using an ultrasound or anything. And the accuracy is actually like stunningly low without ultrasound. I think it's like 50% with surgeons that have done, they're in the joints all the time with surgery. So joints can actually be pretty tricky to get into. So I think that's an important thing, is like actually using the ultrasound to see the nerves, to see the joints, and getting whatever product you're using into the right place is probably as important as the product itself.
I'm definitely very jealous as an acupuncturist. I wish I could do guided ultrasound acupuncture. That would be amazing.
Oh, yeah. Yeah.
We
Well,
do
that's
have
actually oh, go ahead. I was just going to say a lot of acupuncturists start doing the perineural injection therapy. It's not, you can use ultrasound or not, but in actually injecting rather than just dry needling. And they seem to like that a lot.
Yeah. Yeah. And there's a whole field of biopuncture too. That's just a similar category, like using homeopathic injectables. So we do have a question about if I wanted to start detoxing myself off of alcohol and other negative substance, such as nicotine, which of these treatments would aid in helping ease the process of detox?
Yeah, that's a great question. So I think probably I would look at like what's causing the cravings in the first place. And oftentimes that comes down to usually people with drinking and smoking and substances, it's self-medicating usually for feelings of anxiety, emotional discomfort. So things like the stellate ganglion block and the ketamine can help with that a lot. And then adding on treatments like NAD. So NAD has been shown to be super effective for cravings for addiction, basically for any of the substances. So that's super helpful as well. And then really like the gut produces a lot of the feel-good neurotransmitters. So serotonin, and I've talked about this in other webinars, but serotonin, dopamine, oxytocin. And so if your gut is out of balance, you're not going to be producing those neurotransmitters. You're more likely to feel more anxious, and then you're going to reach for things like cigarettes or alcohol. So yeah, it's nothing is like a one pill fixes all. I don't have a magic wand, but I think if someone were to say, okay, I'm only going to do one treatment, what would it be? It would probably be the stellate ganglion block. I think out of all the treatments that we have, that one it packs the most punch with the least amount of effort and resources and time.
All right. If we do have, we have another minute. So one last question would be, how long does it take to heal after injections?
Oh yeah, that's a great question. So generally speaking, like I was showing kind of the healing cascade for people. Generally speaking, when we do the injections, people start to really feel the results of it in the 8 to 12 week range. So that's important to note. So, and again, what we're kind of doing is we're almost like re-injuring or re-stimulating that area. Not as much as like a hot poker with the gladiators, but if we're injecting a rotator cuff, we're basically like, okay, immune system, come here. And the body takes at least 6 weeks for it to heal on its own. And so what we found usually is it's somewhere in that 8 weeks to 12 week range where people really start to feel better. The healing is starting right away. And it's going to continue beyond 12 weeks, but it usually is that 2 to 3 month range when people really start to feel better in terms of their mobility and their pain. Good question.
Great.
Awesome. Well, I think that's probably good for questions on timing. And I just want to thank everyone for coming, and then let everyone know of a few things coming down the pipeline. So We're going to start having health coaching webinars, which is going to be awesome. I think a lot of people don't understand really what health coaching is or how it can help them, or what coaching even is and how that can help in this capacity. So we're going to have a webinar on January 23rd, talking about what is health coaching and what is group health coaching and how it can help get your body in balance more efficiently. And then on January 17th, I'm going to do a webinar on how to change your mind. The Michael Pollan book, everyone's really excited about, and the Netflix on how to change your mind. I'm just going to talk about ketamine and other psychedelics and why spirituality matters from a scientific standpoint and how that helps with health outcomes. And then if there's anything that you want to learn about, please put it in the chat box or send us an email or send us a message through the portal so that we can add that to our list of webinars.
Yeah, and
Thanks
if you
so
can
much, everyone.
if you can make it on January 3rd, all the coaches at Boost will be present. So it'll be great for you guys to meet the gang.
Awesome. Thanks, everyone. Thanks so much, Jen.
Of course, thank you. It's been a great learning experience. Appreciate your time.
Thank you so much.
All right, bye, everybody.
Take care.